everyone, welcome to the Front Row with Ed. And today we're going to talk about a subject that is in the news quite a bit, especially since it's football season right now, and that is concussions. Okay, so parents, if you have a child out there that is playing any type of contact sport, football, lacrosse, soccer, hockey, anything where you think they may hit their head, well then take a few minutes and listen to what I have to say, please. It can make a significant difference, okay? There is a simple test that we can administer on the sidelines now, okay? Involves simple flashcards, okay? And I'm going to talk about it. It's called the King-Devick test. And what it does is it helps to objectify something that can be very subjective. Okay, so if you feel like your athlete has suffered a concussion, okay, the challenging part is they will often downplay their symptoms, okay? So unless it's very obvious, okay, maybe they're vomiting, maybe they've lost consciousness, anything obvious like that, then they're done, okay, until their physician clears them to come back again, but definitely done. But most of the concussions that we see a lot of times on the sidelines are the ones where they're a little banged up, but a minute or two later, they feel like the cobwebs are gone and they're ready to go back in, okay? And that's where it gets a little bit subjective, okay? The athlete will downplay any type of symptoms that they have. So even if they have any type of significant headache or ringing in the ears or anything, they may downplay because they want to get back in the game. They're competitive and they're athletic, okay? So enter the King-Devick test, okay? It's a simple test, and I'm just going to show you a couple of these flashcards here. Basically what it involves is 3 flashcards, okay, with a series of numbers, okay? And you notice the first one here, there's lines, and the second one gets a little bit harder to read because you got to track it because now you're following the lines left to right, okay, without the advantage of having the lines. And then the third one, okay, just a little bit more challenging, okay, but you can still read them left to right, okay? And this is how it's going to work. What you have to do is you have to test your athletes first, okay, so while they're healthy, okay, so make sure that you can test them sometime, like maybe during practice, pull them over one at a time. All you need is a stopwatch and these simple flashcards, okay, which you can get online, okay? And then you record how long it takes for them to read each flashcard, okay? You add up the score and you keep that as a baseline. Just make sure your athletes are giving 100% effort and they're reading them as fast as they can left to right, okay? You keep all that and you have it available at the game, okay? So now you think that same athlete may have suffered a concussion, okay? They don't have the obvious symptoms that would pull you out, that would make you want to pull them out of the game, okay? They feel like they're ready to go back in, and then what you do is you have them reread, okay? So make sure you have your cards. I got them laminated here, so whenever I cover on-field stuff in case it's raining, I don't have to worry about them getting wet or anything like that, okay? Have them read all 3 series of numbers on each flashcard and record the score, okay? Then take that score and compare it to their baseline score that they did when they were healthy before they got hit. Okay, if their time is 3 to 5 seconds longer, okay, they are more than likely to have suffered a concussion and need to be pulled from the game immediately, regardless of what they say, okay? Now, this test is surprisingly accurate, okay, even though it's a simple flashcard test, it's surprisingly accurate when they compare it, okay, to brain imaging tests. And the reason is that about 50% of the pathways in our brain, okay, are dedicated to our visual sense and tracking, okay? So what that means is that if there's any type of brain disturbance, injury, whatever we want to call it, more than likely it'll be reflected in our sense of vision and our ability to track, okay? And the first thing that'll happen is it'll slow down because it'll take longer for the brain to process those numbers and to be able to track it, especially without the lines, okay? It's a simple test. The great thing is that anyone can administer this test. You don't have to be a medical professional to be able to do that, okay? Record their score, designate someone at each game to be able to do that. All you need is a stopwatch. If it takes them more than 3 to 5 seconds longer than it did at their baseline, then please pull the athlete out of the game, okay? So it's a simple test. It can make a huge difference. I have a set of laminated cards at the clinic here. I've got about 3 or 4 extra. If someone needs them, let me know. If you're coaching, youth football or something like that, I'll be happy to just give them to you. If not, you can go online and get it. It's the King-Devick test. and it can be a real life changer, okay? So good luck. Let me know how you do, and let's be careful with our athletes, okay, and take care of them. Thank you.